This is Tampa-based 10 News This Morning.
Well, right now, and only on the morning show, we're getting our first look at a live liposuction procedure. It's a real procedure, so be aware that what we're about to show you could be a little graphic, especially if you're having breakfast or coffee this morning. This is a look at 42-year-old Felicia Murray as she is getting Aqualipo on her love handles right now. That is hard to watch because I can see it all moving there. Okay, she's at the Bassin Center for Plastic Surgery in Tampa. This is happening live right now. Aqualipo is a brand new procedure that uses water to flush out the fat. Basically, it's like a power wash under your skin. It uses only local anesthesia, so the recovery time is faster, we're told, than traditional liposuction. Right now, you see Dr. Rigo Mendoza. He's starting the procedure already using the water spray on Felicia's love handles. That is really just it is invasive. We think it might just be something that's easy to go through, and she should be able to walk out there 15 minutes after she has that procedure. But we're going to check in with Felicia in just about 5 minutes with Janie Porter live on the scene there with her as well.
No wincing, which you would have
She's not wincing, but
we all are, yes.
Hey guys, we are here at the Bassin Center for Plastic Surgery in Tampa, and this may be the first time this has ever happened. A live liposuction procedure, if I can say it right here on the morning show. This is called Aqualipo. Dr. Rigo Mendoza performing it this morning while Felicia Murray, our volunteer, is awake. How is that even possible?
Well, we're able to do these under local anesthesia these days because the procedure is much more gentler and less invasive, so they have less pain.
What you're doing right now is using a laser to essentially melt the fat down. It goes out through a tube into this machine behind you, and then what happens after that with the water?
Well, right now what we're doing is we're melting the fat. We're on the second side, and the fat's being melted. Then we'll use the body jet later to wash out the melted fat, and that's when you'll see it coming out the tube again, like we did on the other side.
The water sprayer was just approved for use in the U.S. by the FDA. It's about $3,500 a procedure for the first body part, and each additional body part is about $2,000. Felicia Murray is in here. She's in a state of relaxation, trying to ignore what's going on right now. But you have been a trooper already this morning. What have you been thinking about as you're getting this done? Because I know you're just trying to take your mind out of this room.
Well, I'm thinking about the benefits after.
Exactly. You're going to have under your chin worked on. Your love handles are getting worked on now. But, I mean, we can see what's going on here. I know you're kind of trying not to look, but what do you feel? Do you feel pressure? What do you feel down there?
I feel a little pressure, but not much. I mean, I know they're doing something, but I'm not in a whole lot of pain, so that's a good thing.
Just a little bit uncomfortable?
Yeah.
And what made you decide to get this done? I know you work as a nurse, and it's really important for you to be on your feet for work.
I just have these areas that I've tried to work on, but I just can't get rid of them. So walking and exercising just wasn't enough. So I thought maybe I'll try something different.
And you know, especially for the under the chin area, that is a tough one, because what kind of exercise are you going to do to get rid of that pesky area down there? I want to show you, though, the amount of fat that's actually been sucked out. It's in this machine here, just in that clear canister. But you guys, do you guys have any more questions? I want to make sure I'm getting to everything. Keith and Ginger, anything you want to know?
How much fat will they actually have sucked out by the time the procedure's over today?
I was asking Dr. Mendoza that, too. Our anchors want to know how much fat total will they have sucked out by the end of this, do you think?
By the end of this case, it'll be somewhere probably between half a liter and 1 liter.
How much of that clear canister would that be?
It's hard to, it'll probably be about a third at least of pure yellow fat on top that you see right now.
All right, she's a brave soul, you guys. Again, this is by the end of the morning show. She's going to have all three of these areas done. She's already had one side of her abdomen worked on. The other side is going on right now, and after that, it's straight abdomen and then the under the chin area. So she's a brave lady.
Indeed she is. My hat goes off to her. Ask her this for us real quickly. Is there any concern that something could possibly go wrong? Because let's face it, this is a surgery.
All right, I'll ask her that. Is there any concern? Are you worried at all that anything would go wrong right now, since, you know, it is a surgery? How are you feeling as far as nerves go on that?
I'm hoping for the best, and hopefully everything turns out okay, and I'm not too worried.
I think you're in good hands. Keith, why you gotta make me ask a girl that while she's on the table.
It's a
we're all
legitimate
thinking
question. I
it.
know. It's a surgery. It's a procedure. You know something could happen. There's always that
Anything.
risk.
Yeah.
Doctors will always tell you that.
All right,
She's
Jane.
awake for it, though, too. I think she feels good about that.
Yeah.
See you in a bit.
All right, bye. Something could happen.
It could.
Anything could happen.
And
We hope
doctors-
not.
And doctors always say there's a chance that something could go
Sure.
wrong. But
Got to ask.
I want to know what
Could
kind of
wait till
releases
later.
she had to sign for that. Yeah.
might as well ask her in the middle of it.
She seems to be doing
not at
good,
all.
as a matter of fact.
Yeah.
Like I said, I think just being on TV makes you half as nervous as it is anyways. And to do that on TV, so she's definitely a trooper.